I mean, one of the things that I really admire about you is that whenever you post a case presentation in a WhatsApp group, or whenever somebody asks for your treatment, you are very upright regarding this is the symptom presentation, this is what I analyzed, and these are the exact medicines and exact treatments that you gave. Some other practitioners kind of withhold that. They do not feel it like sharing with others, though it's very unique for you, but unfortunately many people have kind of secretive behavior and they do not want to share.
See, if our earlier acharyas, our gurus, if they have kept these information as a secret one, then we would not have received these things. So they have given for the benefit of the mankind. So then why I don't want to? Whenever I have information, it is my duty to share it and pass it on to the next generation. Definitely, it will not only improve the standard of Ayurveda and the efficacy of Ayurveda, as well as it also improves the importance and even the confidence of the practicing physicians. And definitely, when a person with experience speaks about certain things, definitely it gives a supporting knowledge and it gives a confidence to practice. And the same thing can be imbibed as well as it might be even practiced in their setup. So that type of thing definitely will not only boost their morale, but also it gives a confidence that we can handle any number of cases or any such cases. So that's the reason we need to share whenever the things are there. And of course, if a given set of condition, if I am treating at my place and I am getting result, it is my duty to see that if the same set of combination, if it is somewhere in across in other part of the world or somewhere it is been happening, if another doctor also uses the same combination with exactly with the same type of situation, if he also gets the results what I have received or I have developed, then definitely it is in a multi-centric trial of the things which is told in Ayurveda. This is one of the important issue that we need to understand. We need to say that, see, I am using these drugs on that condition, I am getting this particular information and I am getting these results. When I am getting these results, why don't you try it at your place, at your condition or your case? If you get the same result, then it is definitely add on to the information. And if in any contrast, if it is there, then we can have a once again a churning, and we can even come out with a many finer suggestions, corrections, or course corrections, what it is. So it's always better that we should have a multicentric trials. So here, this is another method of having a multicentric trial, because if a person or a team is doing a multicentric trial, they may have some coordinated effort and they'll have some typical type of controls over the population and the selection criteria and all those things. But when these type of very lucidly we are sharing the information with our colleagues and friends, and they are using in their conditions, then there will not be restrictions and they may take into consideration that when a treating condition maybe slightly varies, then also we'll get some information after treating those type of diseases. So that's why I always believe in sharing, and I don't keep anything as a secret in this. I don't want to keep it because it has to be passed on to the next generation. Then only the things will be running.
That's so kind and so kind of you, and kind of ideal role model to follow. And also, when senior Ayurveda practitioner like yourself, when you talk about these medicines and the treatment combination and all, not only it will give us as an idea regarding, okay, I mean, in these diseases, these can be chosen, these medicines can be chosen. It also, I mean, looking into, I mean, as an Ayurveda practitioner myself, when I see a prescription from some other doctor, we can also get a hint regarding why that has been selected. So it's kind of a reverse engineering. So through those medicines and through those treatments, which type of Agni, which type of Kosta, which type of Srotas, which particular organ have been targeted and all. So it's not just the medicine, but it's also kind of understanding the giving the information regarding the medicines and treatments will also help us to think, okay, this is not available, so what are the other medicines which have similar ingredients that are available? So it really makes us to think. And also for the new Ayurveda practitioners who come out, even in India and also outside, they know the Samprapti, they know other things, but only one thing that many of us lack is the art of picking the right medicines in the right disease condition. So sharing information with full set of medicines and treatments by seniors helps and encourages the young Ayurveda doctor to pick up the right medicines bravely.
So then definitely that is the reason we need to go for, because in Ayurveda Materia Medica, if you just look into the yoga and combinations, we have got more than 25,000 and above odd yogas, and many of them are not been even touched or explained or explored. So that type of a situation we are passing through. So it's our duty to, whenever we are using it, and of course, not always all the type of yogas and combination we do get every places across the globe uniformly. So there may be certain yogas which may be very popular in India, may not be used available in UK, or it may be not be available in USA, or it may be due to some legal constraints and practice restrictions where you cannot use the nanomedicine of Ayurveda, and may not be some supplier or shipment is not possible to England or something like that. So there will be a wide range of issues will be there. So that's why whenever we come out with certain drugs and combinations, this is are being used. Always we try to select a sannikarsha, means one which is very near to the situation which is demanding and required. But many times it so happens that the particular combination or a particular company or a particular product is not available. Then we will go for the better alternative, because this concept is also told by our acharyas in the name of substitution. Pratinidhi Dravyas has been explained very long back. When there is a particular drug is not available, we can choose some other drug. So this is a very beautiful concept which is explained in Ayurveda. So we need to understand these concepts, and we need to carry on this legacy, and we need to keep on sharing the information. Then only the things will grow. And similarly, and moreover, in front of a physician, treating physician, a patient is sitting, and that patient, whatever the information passes on to the doctor, it is a first-hand information to the doctor, and doctor will be a right person in front of him to decide which is the best medicine. Whatever the combinations we may choose and we may give a suggestion on all these things, it becomes only a secondary level information. It cannot be exactly the first level information. The first level information has to be decided by using the yukti and the knowledge of the treating physician. Accordingly, he has to select and make a choices. So while choosing it, of course, if some other information is available from the experienced persons, or from the books, or from the research, definitely that should be taken care of and it should be utilized. So that will give definitely a morale boosting type of material. And sometimes maybe in a complex situation, you may using a very beautiful combinations as told by other acharyas or some other treating physician who got success in that particular type of case. So definitely such information has to be used in order to have a success in the treatment.